In a major development that could reshape how millions of older adults in England access healthcare, the government has confirmed that free NHS prescriptions for those over 65 are set to end under a sweeping new policy. This marks one of the most significant changes to the National Health Service's prescription system in decades and has sparked widespread concern among pensioners, medical groups, and social welfare organisations. Welcome back to UK Pension Hub. Today we're breaking down the details of this rule change, what it means for you, and what steps you can take before these new rules come into force. For generations, free NHS prescriptions have been a cornerstone of healthcare support for older citizens. Since the mid-1970s, anyone aged 60 or above in England has been entitled to receive prescribed medicines without charge, a benefit that helped millions manage chronic illnesses without worrying about the cost. For people living with conditions like diabetes, arthritis, or heart disease, this wasn't just a convenience, it was a lifeline that brought peace of mind and stability. But starting in October 2025, the way prescription eligibility works will undergo a major shift. The Department of Health and Social Care has confirmed that the free prescription age will no longer be fixed at 60. Instead, it will align with the state pension age, currently 66 and likely to rise further in the coming years. This means individuals between 60 and 65 who are not yet receiving the state pension will soon have to pay for prescriptions. Considering that a single NHS prescription costs £9.90 per item, the financial impact could be substantial. Many older adults rely on several medications each month, meaning annual costs could reach several £100s. For example, someone taking 4 prescription items a month could pay close to £480 per year, a serious burden for anyone living on a fixed income or modest savings. The government argues that linking free prescriptions to state pension age makes the system fairer and more sustainable. Officials claim that maintaining the current scheme has become too costly due to longer life expectancy, an aging population, and rising NHS expenses. They estimate that this reform could save around £250 million annually, funds that, they say, will be reinvested in frontline healthcare services. However, critics warn that these savings might be offset by higher long-term costs. If older adults skip essential medication because of price, their health can deteriorate, leading to more GP visits, hospital stays, and long-term complications, all of which can cost the NHS far more in the long run. So, who stands to lose access to free prescriptions under the new rules? Primarily, those aged 60 to 65 who haven't reached the state pension age and aren't receiving benefits such as pension credit or income-based support. This includes part-time workers, early retirees, and people with modest private pensions who don't qualify for additional assistance. On the other hand, certain groups will remain protected. Free prescriptions will still be available to anyone aged 66 or older, people receiving pension credit, and individuals with medical exemption certificates for chronic illnesses such as cancer, epilepsy, or diabetes. Low-income claimants with NHS tax credit or HC2 certificates will also remain eligible for help. It's important to note that this reform only applies to England. Scotland, Wales, and Northern Ireland will remain unaffected, as prescriptions there are already free for everyone. This difference has reignited debates about fairness between the UK's nations, with many campaigners and MPs calling for equal access to medicines across the whole of the UK. For many, this isn't just a question of policy, it's a matter of principle and equality. The rollout will happen gradually. The new eligibility rules take effect on October 6, 2025. From November 2025, the NHS will begin sending updated eligibility letters to patients, informing them of their new status. By January 2026, pharmacies will start verifying proof of entitlement in real time. Then by April 2026, anyone claiming free prescriptions without eligibility could face a fine of up to £120 per incident, in addition to repaying the cost of the prescription. The NHS will also strengthen data sharing systems with the Department for Work and Pensions, making it far easier to detect and investigate false claims. These tighter measures are designed to prevent misuse, but they also mean that honest mistakes could result in penalties if people fail to update their information in time. Unsurprisingly, the announcement has drawn strong public reaction. Charities such as Age UK, Silver Voices, and the Patients Association argue that this policy unfairly targets those just below pension age who often face serious health challenges. Many fear that the change will push vulnerable adults to choose between essentials like food, heating, and medication, a choice no one should have to make. Research already shows that about 1 in 10 pensioners occasionally skips prescriptions due to cost, and campaigners warn that number could rise sharply once the reform begins. Some have called the move a hidden tax on aging, warning it undermines fairness, dignity, and trust in the NHS. Petitions opposing the reform have already gathered more than 600,000 signatures, and protests have taken place outside Parliament and NHS offices. Cross-party MPs have voiced their concerns, saying the policy could hit women and lower-income households the hardest, particularly those who left work early to care for relatives or because of long-term illness. For many, this debate is not only about money, but about maintaining the founding values of the NHS, a service based on need, not on the ability to pay. If you're between 60 and 65, there are several ways to protect yourself before the new rules come in. First, check whether you qualify for pension credit. Even a small entitlement can unlock free prescriptions and other valuable NHS benefits. Second, apply for help through the NHS Low-Income Scheme, which can cover either full or partial prescription costs. If you live with a long-term health condition, apply for a medical exemption certificate. Conditions such as diabetes, epilepsy, cancer, and thyroid disorders are among those that qualify. And finally, use the government's pension age calculator at gov.uk to confirm exactly when you'll reach your state pension age. Acting early could save you hundreds of pounds each year and prevent any disruption to your medication access. The government insists that the reform promotes fairness, noting that many people in their early 60s continue working and earning regular incomes. But critics say this argument ignores the realities faced by those who left employment early due to poor health, redundancy, or caregiving responsibilities. They argue that charging this age group for prescriptions risks worsening health inequalities and placing more pressure on the very people the NHS is supposed to protect. Ultimately, the real impact of this change will only become clear over time. While the government projects savings of £250 million per year, many healthcare experts doubt those numbers will hold once the long-term consequences are felt. Fewer people taking necessary medications could result in higher hospital admissions and poorer quality of life for many older adults. The reform may also deepen the divide between England and the devolved nations, where healthcare access remains universal. As the deadline approaches, campaigners are expected to continue pushing for amendments, perhaps calling for a phased rollout or exemptions for those with multiple prescriptions. In the meantime, the best approach for older adults is to stay informed, check eligibility, and make sure all NHS and benefit records are up to date. This proactive approach can make all the difference when the new system begins. The end of universal free NHS prescriptions for over-65s represents a turning point in British healthcare policy. What was once a guaranteed benefit is now tied to pension age and income thresholds. Whether you see it as a modernisation effort or a rollback of long-standing social protections, one thing is clear: this change will affect millions of lives. Staying informed and prepared will help ensure that you continue receiving the care and medication you need without unnecessary financial stress. If you found this update helpful, make sure to subscribe to UK Pension Hub for reliable coverage on DWP updates, NHS benefits, and pension changes across the UK. Don't forget to like, share, and hit the notification bell to stay informed about every major policy change that could impact your future. Thank you for watching. Stay informed, stay prepared, and as always, take care of your health and your finances. We'll see you in the next video.